Dr. Anil Poti was thought to have developed a revolutionary new way to treat cancer patients. At around the same time, Juliet Jacobs was dying of stage 4 lung cancer. After involving herself in numerous clinical trials, she had one last chance. In her desperation to find a solution, she came across Dr. Poti's well-publicized research and agreed to take part in one of his studies. She died 3 months later. In 2010, questions were raised about the validity of Dr. Poti's results. It turns out he had manipulated the data in order to fit his original hypothesis. And although the study did have to be peer-reviewed before being published, the data itself was never experimentally verified. The study that Jacobs had chosen as her last chance turned out to be a fraud. Because scientific journals generally do not publish verification studies, scientists generally do not have their data experimentally verified before getting it published. This is because in the scientific community, the more research you have published, the more distinguished you are. This is referred to by The Guardian on September 5, 2011 as the publish or perish mentality. And for the sake of people like Juliet Jacobs, it needs to be changed. Today we will discuss the problems with this mentality, see how such carelessness arose, before finally taking a look at some solutions. The two most dangerous downsides of publish or perish are medical risk and a negative perception of the scientific community. First, patients and physicians read this newly published research and make important health decisions based on the data. A physician might read a newly published study and then offer the new treatment to a patient. However, if this treatment ends up being based on data that's faulty or unreliable, this could have life-threatening impacts on the patient. Scientist Glenn Begley, working for Amgen Corporation, attempted to replicate 53 major studies involving medical science. He was unable to replicate the results for 47 of them. This means that out of all the studies that were retested, only 11% had any kind of scientific merit. And while it's common for studies to fail in the preclinical trial phase, it's irresponsible for scientists to publish them as fact. However, this continues to happen at the expense of thousands of patients who hope to benefit from the treatments outlined. And it only continues to happen because scientists do not get their data experimentally verified before getting it published. Additionally, this phenomenon leads to confusion about science in the general population, leading to anti-science and anti-intellectualism. Oftentimes, when research is published and then must be retracted because it's faulty in some way, further research is done and then contradictory data is brought in to replace the previous study. When this happens, it causes confusion among the general population. This is why many faulty and untrue myths about our health persist. For example, the belief that vaccines cause autism. In 1998, Dr. Andrew Wakefield conducted a study that, it was thought, definitively proved that vaccines cause autism. However, the study was found to have been falsified, and all the children involved in the study had reported developmental issues before the start of the trial. And while it's well reported that the CDC has investigated the effects of vaccines and found no links to autism, many parents continue to refuse to vaccinate their children, with dire public health consequences. According to the New York Department of Health, cases of mumps in the United States are on the rise. In 2001, there were 365 cases of mumps in the United States. In 2006, there were over 6,000. Mumps is a very dangerous but completely preventable disease that's increase in prevalence is due almost entirely to lack of vaccination. And while it makes sense that because most of the general population does not have a firm grasp on the scientific process, when these types of retractions happen, it causes skepticism and mistrust towards scientists. That's why it's vital that scientists only publish research that has been well verified. Now that we've discussed the problems with this mentality, we must explore the causes. There are two central causes: lack of reward and lack of accountability. First, the scientific community rewards scientists that have a high volume of published work. According to a March 2012 article in Nature magazine, scientists are required to be first author on a certain number of papers in order to get tenure positions at research universities and certain research grants. And although all the studies must be peer-reviewed before being published, this does not include actually retrying the experiments to make sure that the data can be verified or replicated. This means that many studies that cannot be replicated simply slip through the cracks, allowing this carelessness to continue. Second, there's nothing actually requiring scientists to have their data experimentally verified before getting it published. This means that a scientist can publish a study that is completely faulty, take no hits to his or her credibility, and actually forward their careers by having more research studies to their names. And judging by the Amgen study, scientists are not doing this voluntarily. According to the March 2012 article in Nature, this is causing a climate of carelessness and out-of-control self-interest in the scientific community, which rivals that of 50 years ago. Now that we have discussed why this is problematic and how this phenomenon has occurred, we can pursue solutions through governmental and personal action. First, as suggested by science writer Carl Zimmer in the 2012 Slate article, we must reward scientists who do have their data experimentally verified before getting it published. We can do this by giving scientists that have their data verified in this way a certification badge to be printed on the paper when it is published. This will give scientists that have earned this certification more credibility, and soon, studies without the certification will simply be phased out. The only thing more dangerous to a scientist than a lack of publication is a lack of credibility. Therefore, this system will provide sufficient incentive for scientists to get them to practice more responsibly without the need for excessive enforcement. Additionally, because the processes that the scientists have developed to get their data in the first place have already been finalized, this can be done for about 10% of the cost of the original research. Also, taking the extra time to verify the study has more benefits than downsides, not only for the general population, but for the scientists themselves. Currently, scientists are forced to publish as quickly as possible. This new system will allow them to avoid retractions and restore the public's faith in the scientific process, bringing more support and talented minds into the field. Second, we all need to learn to take newly published scientific work with a grain of salt. Every time a new study is published, we need to ask ourselves, has this data been verified? Can I trust this research? Because although we can do what we can to minimize the causes of publish or perish, scientific error cannot be completely eliminated, even with the main causes of publish or perish minimized. However, we can avoid the dangers and frustrations that come from treating newly published scientific research as gospel. When a new scientist must come forward and admit that his or her previously published work is faulty in some way, that scientist has not committed fraud. He or she is simply practicing good science. As a matter of fact, this is the most important part of the scientific process because it opens up the field and allows for further research. If we can recognize this fact, we can avoid the frustration and confusion that we as lay people can feel when dealing with the fast-paced and constantly changing world of research science. Juliet Jacobs deserved a study with real hope, not falsify data as her last chance. If Dr. Pody was forced, through the certification system, to have his data experimentally verified, she would have gotten that chance. If we can learn to treat newly published science with a little more skepticism and urge the scientific community to initiate the badge certification system for verified results, she will not have died in vain. Currently, science is sloppy. Scientists are more concerned with how many research papers they have published than all the people they can impact with their research. Fortunately, publish or perish can be squashed out by simply rewarding good scientific practices and allowing the bad ones to die out. Science is a wonderful thing. Today's world wouldn't be possible without it. But if we continue on this path, more people like Juliet Jacobs will be hurt. And it is our responsibility to make sure that doesn't happen.